So many people want to talk about how to lose weight or be healthier in preparation for plastic surgery, surgery in general, life in general. And people are seeing more and more of these devices on the backs of people's arms. There you can see the spot where mine was. And there's some concern as to what's in it or what it does. This is a continuous glucose monitor. I'm going to explain that in just a second. By the way, the needle that goes into your body is actually this very flexible wire, and it's not particularly sharp. You can see I'm pushing it with my finger, and the delivery device allows it to straighten up and fly right and go in. Designed to last for 2 weeks unless you manage to catch it on a door frame. Oops. And then it lasts a little bit longer, but nevertheless, this is one of the strategies. So at the end of the day, if you're serious about losing weight and you're beyond the age of, let's say, 12, chances are your diet plays a far more dramatic role in your weight gain and loss than your level of exercise. You can't outrun a bad diet. For years, I have recommended 2 books to people. You'd think Dr. Fung sends me $1 every time I mention it, but the original book was called The Obesity Code by Jason Fung. And then his follow-up book, which I think is equally important, is The Diabesity Code. And so everything has to do with how much sugar you put in your system, and that's why you may want to monitor with this, but it really comes down to your resting level of insulin. And so the notion of intermittent fasting is not to necessarily starve yourself, but rather let your insulin level finally fall down into a normal range, because let's face it, type 2 diabetes, for example, by definition is insulin resistant. Why is it resistant? Because your insulin level has been high persistently for so many years. Well, that's a short version on weight loss, gain, insulin, and sugar. Hope that was helpful. Bye.